Good evening, ma'am.
So our session is being recorded.
Sure.
So I'm Srirupa, and on behalf of ISST and Heinrich Boll Stiftung Regional Office, New Delhi, it is my pleasure to welcome you all to the 36th Gender and Economic Policy Discussion Forum on shifting masculinities in contemporary India and everyday implications on gender inequalities. This year marks the 10th year of the Gender and Economic Policy Forum, and I would like to request Shalini, Deputy Director, Heinrich Boll Stiftung Regional Office, New Delhi, to speak about the forum and also the long ISST HPS collaboration. Welcome, Shalini.
Thank you, Srirupa. Am I nicely audible?
Yes, you are.
Yeah.
Thank you. Thank you. Warm welcome, everyone, to the 36th Gender Policy Forum. Very glad to have you all with us this evening. Special welcome to our panelists and the chair, Dr. RAVI VERMA. Most of you, I recognize a lot of the names here, have been attending our forums and sort of know that these are pretty much informal, regular spaces for easy conversation, civil society-based analysis on the linkages of the gender and equity dimensions of our economic and social lives. We, Heinrich Boll Stiftung and ISST, have been convening these dialogues, as was mentioned by Srirupa, since 2012, and delighted that we celebrate this milestone decadal birthday of the gender forums this year, the last of this forum of the year with you. I take great pleasure in congratulating and thanking ISST for being our collaborating partner, for bringing in the forums a very high level of expertise in terms of speakers and panelists, their commitment, a very, very competent team, for the wonderful support all along that has made the event such a success. It's been an absolute pleasure to be there in this journey with you, ISST. For Heinrich Boll Foundation, feminism and gender democracy are key pillars in our mission and work worldwide. And it's the shared value to promote women's rights, equality of all genders, gender justice that guides our numerous initiatives, projects, and collaborations throughout the years. Recognizing now that men in India as elsewhere should be proactively involved in the effort to create an egalitarian society, we at Heinrich Boll Stiftung have only, I must admit, recently turned our focus on the thematic field of men and masculinities. It's been sort of elusive till now. Of course, we work with the broader concept of ecological masculinity, if I may say it like that, by which the perspective mostly coming in from the climate justice debate is North-based, men-centric, being the cause, although not only, of perpetuating unfettered industrialization, putting anthropogenic pressure on Earth's living systems. So we work on global commons, a broader, deeper, wider care of the global commons with the vision of ecological feminism and feminist care theory. In today's session, we focus on shifting masculinity. And before I introduce a little bit more of our organization, some questions to the speakers with the hope that these will be addressed, some of these would be addressed. What does masculinity mean? What are the popular perceptions and attitudes on Indian masculinities? How does a man become a man? Masculinity and violence, modern fatherhood, positions vis-a-vis feminism, gendered management in the context of COVID-19 pandemic. There was a mail this morning in my inbox with the subject line, "There is no one kind of a girl." Yes, there is not. There is no one kind of a reality, no? We just want to put world into essentializing categories, not generic categories. that divide us in hierarchies, men over women, heteronormative masculinities over deviant masculinities, etc. How much we need to embrace pluralities. That's also one of our working themes in India for HBS. We need refreshing visions towards equitable societies that celebrate healthy and diverse masculinities. Before I hand it back to you, Shrirupa, a few words on HBS. We are a green political foundation, part of the green political movement that has developed worldwide as a response to the traditional politics of democracy, socialism, and liberalism. The name Heinrich Boll Stiftung is derived from Heinrich Boll, one of the most meaningful post-World War writers. He personifies the values Heinrich Boll Stiftung stands for. Stiftung translates into foundation in English. In 1972, Heinrich Boll received the Nobel Prize for Literature. We are headquartered in Berlin with 31 offices worldwide in 60 countries. And our work focuses on ecology and sustainability, democracy and human rights, self-determination and justice. We are a green think tank. And we forge strategic partnerships with those who share our values from civil society, academia, media, and government institutions. Our India office was set up in 2002, and since this year, we are a regional office situated in New Delhi. Our partner, Institute of Social Studies Trust, ISST, is a public charitable trust, has been committed to the cause of equity and well-being of poor and marginalized women across communities since its inception in 1980. Using a gender transformative approach, the main focus areas of ISST's work have been pursuing multidisciplinary social science research, both at the grassroots and policy scale, conducting critical evaluation studies of the programs, and direct community outreach that seeks to empower women, children, and adolescent youth through community mobilization work, information, and inputs on education. Over to you, Shrirupa. Thank you.
Thank you so much, Shalini. And as Shalini mentioned and nicely explained, topic that we are going to pick up for discussion forum today. So without much ado, I will straight away introduce our brilliant panel that we have with us today. Firstly, I would like to introduce Dr. Ravi Verma, who would be chairing today's panel. Dr. Ravi Verma is Regional Director at the International Center for Research on Women, ICRW Asia Regional Office in New Delhi, India. Over the past 3 decades, he has worked on issues of gender, men and masculinity, male sexual health, and gender equality in relations to violence against women, reproductive health, including family planning and HIV/AIDS in India and countries across the Asian region. He has published extensively on these issues in both Indian and international journals of repute. Prior to joining ICRW in 2007, he has worked at the Population Council in New Delhi and at the International Institute of Population Sciences in Mumbai, where he was professor in the Population Policies and Programs. Ravi has also served as a member of high-level committee on the status of women from 2013 to 2016 for the Government of India and the Rights and Empowerment Working Group of the Family Planning 2020 initiative. He currently serves as a commissioner on the Lancet Commission on Gender and Health. He also serves as the boards of Women Lift Health and Global Health 50/50. It is a pleasure to have you with us, Dr. Verma. Thanks a lot. And as part of our panel, we have with us Professor RADHIKA Chopra, who was formerly Professor of Sociology at the University of Delhi. She's the author of Amritsar, A City Remembers, Militant and Migrant, The Politics of Social History of Punjab. Apart from that, a number of edited books also she's authored, such as Reframing Masculinities, Narrating the Supportive Practices of Men and South Asian Masculinities, Context of Change, Sites of Continuity. She's also published extensively in peer-reviewed journals and chapters in edited volumes on South Asian and Indian masculinity, martyrdom, urban landscapes, migration, and visual ethnography. Her forthcoming book, Migrant Lives, brings together her interest in visual ethnography and migration. Thanks a lot for joining us today, Professor RADHIKA Chopra. We also have with us today RENUKA Motihar. RENUKA Motihar is an independent consultant based in Delhi, working on social development issues. With a background in social sciences, RENUKA works in the area of young people's health and development, reproductive health, and broader social, leadership, and gender-related issues. RENUKA has worked as a program consultant with various international and national agencies, including the UN agencies, private foundations, non-profit, and consulting firms. Her focus has been on landscape analysis and scoping studies, program planning and strategy, impact assessment, program evaluations, knowledge building, and learning. Finally, we have with us MANAK MATIYANI. MANAK MATIYANI is a feminist and queer activist and the executive director of the YP Foundation, an organization that develops young people's rights-based, feminist, and intersectional leadership of social change. MANAK has led work on issues of gender justice, sexuality rights, health equity, and inclusion as a trainer, filmmaker, development professional, and facilitator with young groups and national and international organizations. So before we proceed any further to the presentation of our speakers, I would like to inform our participants that this event is being recorded. Kindly post your questions and comments in the chat box, and please also indicate to whom your question is directed to. We will try our best to address them post all the presentations. The presentations are planned to be around 10 to 12 minutes each, and we would be proceeding to the discussion round right away. So it is with great pleasure that I welcome and hand over the floor to Dr. Ravi Verma. I would request you to kindly present your opening remarks.
Thank you. Thank you, Sri Rupa. Good evening, good morning, good afternoon, and welcome to this discussion forum. I really thank ISST and HBS for giving me this opportunity to be part of this esteemed panel, in fact, to be sharing ideas and learning from my co-panelists on new thinking around masculinity. And I thank Shalini for setting the stage, for raising those questions. I think those are important questions to answer. And that sets the kind of framework for us as presenters and the ones who want to discuss this. Well, before I hand over the platform, the floor to Dr. Radhika Chopra, who's going to be our first speaker, and other speakers, I thought I'll share my reflections on those questions and where I come from and what I think of this complex issue of masculinities, gender, violence. So I'm trained in demography and psychology, and I come from a training which is very masculine, actually, because both psychometrica and the demographic analysis data, they are very top down and quantitative. Anything which is quantitative and defined, structured, is, in my view, is very definitive. It has pluses and minuses, of course, that one could argue. But last 15, 16 years, I have been working on issues of gender. My heart lies in the feminist thinking of how we look at the world issues and global issues. And that really is an alternative ways that offers an alternative way of looking at the alternative framework. Within ICRW, me and my colleagues have been engaged with this issue of gender and masculinity from this wider lens of understanding where does this discourse fit into larger feminist framework, and what does it mean? We conducted large-scale surveys. That is one of the survey that is very well known is International Men and Gender Equality Survey that we carried out across several countries. India was one of the first ones that we did, and many variations of that survey we have used in other studies. We also developed scales to measure masculinities and trying to deconstruct how does it relate to several outcomes, including violence against women. Our primary focus within the ICRW has always been to understand where where does this violence come from, and what are the structural dimensions of it? And within that framework, masculinity and gender norms really are one of the key issues that we are trying to address. So, and let me tell you some of the key lessons that we have learned, and still it's evolving, is that the notion of masculinity, men in India especially hold very complex attitudes towards gender. It is not simple, they're ambivalent, in fact, by and large. And for example, you would find men holding, a large number of men holding a view that supporting women's education and work. And I think that has changed. It has really changed to an extent where you see more and more men supporting women's education and women's work. But at the same time, a disproportionately large number of men compared to any other setting. And even within and there's a lot of variation even within India across communities, they would say that the primary role of women is homemaking. And if it comes to making a choice, then it is women must give up the jobs. Even if they are qualified and professionals, they have to be at home. They have to look after. And we have seen this during the pandemic time, how women were pushed into the care providing role much more than even if they were working. And when it came to the making a choice, the women were the ones who gave up the work first. And men, there was a masculinization of spaces when men came back into the households and lived for a longer time, still continuing this pandemic phase in some ways. It really marginalized women in many ways. We have seen rise in domestic violence and expressions of masculinity. And so that means that this ambivalence is something that is very something that we need to understand and build that into our programs in our understanding. I'm sure I'm looking up to Dr. Radhika Chopra's and work from MANAK on how are they addressing some of this ambivalence and pushbacks that we see in program. But one thing is true, that a lot of again and again the surveys have shown and the studies have shown that for a large number of men, it is a zero-sum game. They think that if women get rights and the women are given access to making choices, then it is they who stand to lose. We have in images surveys and subsequent studies shown that how men see a lot of, in fact, they say that women have gained a lot from all these empowerment programs and policies, and they feel there is a resentment. And the data, on the other hand, also shows that men seem to think that if they fail to perform the expected role of being a provider or being in a dominant financial decision-making position within the households, then it leads to depressions and it leads to a lot of violence, and it is, it's regressive in the manner they practice. So yes, the role that men think or the context and situations expect them to perform is so deeply entrenched that this is that men, even if they're extending their boundaries to accommodate, they want to make sure that they still have a say in that, or their consent is taken. And why I'm saying this is because a lot of our program on gender transformation have really taught us one thing hard way, that a lot of these programs, men and boys do show a change in their attitudes and they demonstrate equitable behaviors, but they feel resented. They don't sustain those behavior change. They very soon they go back to the same position after some time. Bystander interventions have shown that they would on the they would say that yes, I would not commit violence, but when their peers are committing violence or sexually harassing or there's an harassment they witness, they don't intervene there. They don't stop. So the peer pressure, they continue to work against the peer, and they continue to align with the peers, and that means that the masculinity is the work that suggests that masculinities are produced in different settings, and men in households and men within their own friends groups and men in the workplaces produce different, they express different kinds of masculinities because they are determined by the context within which they live. But it's a vicious cycle, where it's kind of cyclical. When men reproduce those ideas and get reinforced, that and in some ways it seems that there is a much more hardening of these attitudes at one level. And I'm saying it with some amount of reflection on this, that this hardening of attitudes, is this a recent phenomena, or has it always been? Was masculinity always in crisis and behaving like this, or it was always a kind of a situation where men and the ideas around patriarchy, ideas around power, always found a way in which they pushed back any change that tried to bring about fundamental change in these equations. So there is a limit to which the changes are accepted or tolerated, accommodated, but then beyond that there is a pushback. And in most gender transformative program, I was saying, the programs seem to co-opt this language. They have co-opted this because it's politically correct to be saying that we are doing transformative program, and they do transformative programs by good intentions. But I think by and large, we are not transforming the institutions. We are not transforming the contexts within which these masculinities are produced or reproduced. We don't have that much of a either courage or the means or wherewithal to shift the larger context within which these masculinities are produced or reproduced. I'm saying this because I'm concerned from the other side of the fence, where programs are supposed to be engaging with men and boys to not only reduce violence, but also achieve some kind of tangible outcomes on many things, including health and reproductive health. So I think the field is evolving. I'm not trying to be pessimistic about this. I think I'm trying to say that working with men and boys, addressing the issue of masculinities is not a simple unidirectional, linear kind of a program that works. It is a far more iterative and reflective process, and we are all, I think, committed for a long time into this, in trying to address this. I have, just before I hand over, just what are the core ideas which I think are deeply embedded in Indian psyche of masculinity, of patriarchy. And we have included these 4 ideas into our measurement scales for measuring. One is sun preference. I think one of the key markers of masculinity and masculinization is a very strong preference of sun. And I think it's reflected in everything that we do, from how properties and lands and how our transfer, lineage and inheritance happens. And so sun preference is a very strong, and that also shows up in other health related parameters. And then dominance in sexual and reproductive choices. That's, men's ability to, men's preference to have an upper hand or decision making on sexual and reproductive choices. We know that. The financial dominance is another norms around that. Which is the providing role, third domain. And the final, I think, is the belief that women are primarily made for homemaking, and the girls are meant for marriage and to take care of others. And that's we have seen despite increasing educations, increasing work status, the marriage remains an obsession. Marriage remains for girls a kind of an issue that is far more stigmatized in case of a single woman than a single man. Of course, some would argue that single men also are highly stigmatized because they're supposed to have. Because it's in the masculine world, if you don't get a girl, then who else will get a girl? So that's right. But the kind of violence, kind of discriminations that single women experience, and the resource deprivation that is around them. Men, at least single men, have resources with them, given the power and control over and access. So I'll just end here and leave some threads for more discussions. I didn't want to go into huge data display here, but I thought I'll leave these thoughts and see how Dr. Chopra and my other co-panelists pick up. I know they have far more deeper insights. I have always respected and learned from Dr. Chopra a lot from her work. So I'm looking forward to listening to Dr. Chopra next. Dr. Chopra, please.
Thank you for the to the Institute of Social Studies Trust and the Heinrich Boll Foundation for giving me this opportunity to share some further reflections, not as sort of wide scale and survey based in the way that ICRW and Dr. Ravi Verma and others have done. But certainly in my own small way, I've been engaging with the idea of some masculinities, South Asian masculinities, and particularly looking at contemporary moments in which the idea of what are we looking at, what are we saying when we say, what does it mean to be a man? So today I just want to look at one aspect of a particular issue, the unpaid care work performed by men. I think as a category, we are all familiar with the literature, with the theorizing on the issue of unpaid care work as it pertains to women. And in fact, the moment we say that phrase, it seems to substantiate and describe the kind of work that women do in the household. So both gender and space are quite clearly demarcated, if you will, within this particular phrase. Nevertheless, despite, and this is despite the kinds of work that is being done on domestic labor, on nursing, on the care of the elderly, etc., which has actually challenged the notion that women and unpaid care work remains in the home, or the home is an area of unpaid work. However, today I just want to shift the attention to the issue of unpaid care work performed by men. And I'd like to do this by demarcating two very broad, sort of rather broad brushstroke like moments or periods of time. The time before the pandemic and the world of the pandemic. Unfortunately, I can't speak of post-pandemic, we aren't there yet. So in just these two moments of time is the way that I'm going to try and figure out or speak about this issue of unpaid care work and gender. I think what I'd like to do then is to, say, let's talk normal, and then let's talk pandemic. I think in the normal circumstance, pre-pandemic, non-pandemic, we normally assume that women are the ones who take care of children and of elders and within the home. Now, I think that this is an assumption that is class blind, and it is also mobility blind. It assumes a very steady household structure. It assumes a static structure over at least 2, if not 3 generations, where one set of women as caregivers, as unpaid caregivers, will teach the next generation of unpaid caregivers what exactly they need to do. Let's for a moment assume that this is an argument that we will stay with, that despite all that we know about the disparities between class and mobility and households and so on, that this association of women and work remains. Now, even in this normal period of time, even within this so-called normal pre-pandemic period of time, before the pandemic, men did do some forms of care work or some forms of work that we might consider to be care work. However, it was care work that was outward oriented. It had outward bound circuits which catered to household requirements. So fetching and carrying, but not wiping bottoms, let's say. Both forms of gendered work are executed to keep the household going, to keep household and society going. Both are forms of work which I think could be classed under, could be categorized under the broad category of care, but only one is recognized as care work. Possibly because of this strong association we have of women and care, which Ravi also pointed out. Let me shift to the world of the pandemic, if not further. I think it's important to try and dislocate this assumption a little bit of care, both contextually and definitionally. Contextually speaking, unpaid care work in non-domestic workspaces like organizations. I think that needs to be addressed, and we need to also look at the unpaid care work performed by men within the organization or for the organization. So dislocated spatially outside of the domestic, dislocated in terms of gender, women, and what are men doing. So I think rather like women's work, the unpaid care work that men in organizations perform in organizational spaces is actually enmeshed in history and society and structure. And in India, I think caste enters very critically into this mapping of work, into the mapping of the unpaid care work of men. Over and over again, of course, that studies have shown us that within organizations in India, power rests not only with men, but primarily with upper caste men. And those lower in the organizational hierarchy, men lower in the organizational hierarchy, are most likely to be of the lower caste within the caste hierarchies. So office lads and cleaners, for example, are unlikely to be very high caste men themselves. They're also class and caste and power sort of combine here very closely. And it's office lads who are, even though their work is clearly demarcated, formally speaking, but they are expected, you know, culture and power, they muddy the waters. And office lads are often expected to perform the kinds of work which is unpaid and in a form of care work. So not just making tea, but also serving tea to you know, their seniors. Cleaners fetch and carry household supplies for senior functionaries. Contract staff in particular are the objects of such kinds of unpaid care work scenarios. And I think they need to care for their seniors without any expectation of monetary return, other than possibly a kind of hope that in the future their job might be a tenured form of job. So this is if we look at the world before the pandemic, these forms of unpaid care work do mime, in part, in one very important respect, the unpaid care work of women in the domestic sphere, is that these forms remain unseen, undocumented, and unaccounted for. Let me turn to the pandemic, which is really around us and which has, in a sense, forced us to look at certain aspects of work lives quite carefully and almost sort of think about reordering what work means and what is work in that sense. I think the pandemic has introduced its own dimensions of unpaid care work in organizations. Class has become entangled with safety, and class has become entangled with mobility. And I think both safety and mobility are critical markers that shape and define what we understand as care work. Now, what do I mean by this? I think right across South Asia, it's quite well established that migrant populations coming into the cities in particular are primarily, a very large component of them are composed of young migrant men. Younger men of poorer households are the most likely to be mobile and migrant, and they are the center way boys of underprivileged rural households. The unpaid care work that mobile men or migrant young men need to perform, in fact, before the pandemic, has been a virtual black hole in our theorizing and reckoning. And so that when we ask the question, what is unpaid care work today? What is unpaid care work performed by men? We really don't know. We don't have a very clear understanding other than that which is anecdotal and often provided by men in a kind of grouse against their seniors or people who are part of their organization or places where they work. So in fact, it's the world of the pandemic that has provided us the context to think of and see the forms of male unpaid care work much more clearly than we ever have before. There are a few things that the pandemic has brought to the surface for us to consider, contextually speaking. It's changed the context, and this is what I'm going to speak about a little bit today is that kind of context. The first, that the pandemic has seen an expansion, if not a boom, in the platform economy. Digital economies have spawned platform care service givers and gig workers in an almost unprecedented way. In South Asian cities, large numbers of young male migrants are employed in different sectors of this platform economy. And apart from this expansion of the platform economy and the production of care work, care services that are provided by platform economy, the expansion and proliferation is also accompanied by a hyperactive demand for safety and the observance of safety protocols. Now, very often the safety protocols are in fact a selling point promoted by companies. We care, we've got you, we'll take care of you. These are their slogans. What we need to know, of course, is, and what we do know, is that platform economies and organizations are much more profitable for the organization than they are for the worker. That's just an aside, it's PS. The demand for safety and the needs for profit, I think, bring a very key question to the surface. Who is actually expected to do the work of caring for safety? who, in a sense, has to shore up the company's slogan, "We care"? Who are the workers who have to support this "we care" and do that work of caring? Who carries, in other words, the burden of ensuring safety? I think the disparity, I think in that sense, when we think about safety, we also need to think about the disparities of safety, the disparities that safety introduces into the world of work. The disparity that safety protocols introduce, that are experienced by, let us say, a settled householder. It's a very different form of safety requirement, of safety observance, of safety protocol from, in contrast to a work from home worker, let's say. They can work, we know that over again, there's lots of sort of fun stuff made about working from home and so on. This does not at all address the issue of the mobile worker. This doesn't take into account the disparities that have become endemic to the pandemic protocol. It is the mobile worker, the one who is the platform economy worker, who is masked for almost sometimes 14 hours a day as a food delivery server, as an Uber cab driver, as a platform economy worker, etc. Most of all, the body of that mobile worker is most closely monitored. What's your temperature today? What do you look like? Are your eyes red? Are you sniffling? Is your nose, running a little bit? So the signs of wellness and unwellness, the body of that mobile worker has become most carefully recorded, and in fact is offered as part of the way in which the "We Care" slogan is supported by companies, for companies, on literally the bodies of these mobile workers. In fact, very often in feedback forms, if you've filled any or been sent any, the first thing that you're asked to record is, did the worker observe the safety protocol? Were they properly masked? Did they come to your door with looking well or unwell, etc.? It's less about organizational slippages, much more about the care that the worker has to take for your safety. It is the worker who has to care. So why are we not paying attention to the kind of safety norms and the safety protocols that we expect Uber cab drivers or Zomato delivery boys or any care delivery service providers to observe? Apart from the paid labor, and of course they are paid, we know that. I mean, platform economies have drawn in many workers in order to be able to facilitate this kind of new labor process of delivery or hail ride and so on. The workers are expected to perform and do care as a safety protocol, not so much for themselves, I think, but for the clients and for the organization. Otherwise, if the worker fails, the organization does as well. So the question comes to my mind, is a worker's care for safety paid for? Is a waiter paid extra for masking for so long? Is a plumber and all the protective gear that he must wear when he enters your home, shoe covers, gloves, masks, head cover, even so that his hair doesn't fall into your sink? Do these platform service organizations, are these paid for or not? Of course, some organizations pay for them, others don't. And there's nothing that regulates the platform economy organization to care for the worker at all. It's the workers upon whom this care is and safety has been devolved. So the protection is for someone other than the worker. The protection that is provided, the care that is provided, the "We Care" slogan is being carried by the bodies of a set of people whom we have not tracked. So we actually don't know what unpaid care work really means within organizations, certainly during the course of the pandemic. The pandemic has allowed us to see it, but we don't really know enough about it. I think existing paradigms of work might not recognize this protective layer or this protective protocol as part of, or 14 hours of masking for that matter, as care work. It's possible that it's not even being thought about as care work. Experientially, I do know that the care expected of a platform economy delivery man is neither recognized nor remunerated as a separate or distinct form of work, and that non-recognition or non-record of that work is not part of organizational account books. The likelihood of this disparity extending to pandemic forms of care and the pandemic forms of unpaid care work is very high indeed. And I think it's time that we began thinking about this much more seriously. I think it is this aspect, this feature of unpaid care work, the fact that it is undocumented and unacknowledged and unaccounted for, that literally catapults the category of pandemic forms of care work and hence pandemic forms of unpaid care work right out of the household, right out of a unigendered structure, and right out of theory as we know it right today. And I just want to end with a very something that is pertinent to all of us today in India. What does pandemic form of care work entail? Vis-a-vis the care of the most vulnerable during the period of the COVID, the elderly and those with morbidities. What forms of care work and unpaid care work will we see, particularly during, let us say, that traumatic second wave that we all spoke about, and which is the one thing that is very clearly recorded? What we did see was the extreme shortage of oxygen and many men with empty oxygen cylinders rushing and ferrying oxygen cylinders from one place to the other, standing in queues, anxiously waiting for filling supplies. Sorry, am I overshooting?
Yes.
Okay, 2 minutes.
I have been warned.
Okay, I'll be done in 2 seconds. Okay.
Thank you.
Now, I think this has almost exclusively devolved this, getting of critical resources for the household has been devolved upon men, partly as a kind of carryover from their outward circuits of fetching and carrying that they always did into the pandemic moment. And I think what this has meant is that now what we need to consider is the intertwining of care and risk. The pandemic forms of care work and the pandemic forms of unpaid care work really need to recognize the interlocking of care with risk, with safety, with the kinds of responsibilities that we have almost unthinkingly devolved without actually thinking about them as care at all. So when we ask the question, what is it to be a man today in India or in South Asia, we cannot ignore the man in the oxygen cylinder queue. I'll stop.
Thank you, Dr. Chopra. Thank you so much for this very thought-provoking. So now that we are running short of really time, may I request Renuka is the second one, right, to come in the sequence?
Yes, that's right.
Yes. So this is really a challenge for both Renuka and MANAK. I request you to be really be economical about the time.
Yeah, I do apologize for overrunning and overshooting. I beg your
also
pardon.
did. I'm also equally culprit. I think I also I'm sorry.
Anyway. Thank you, Dr. Ravi. And I'd like to thank ISST and HPS for this opportunity to speak today. Good evening, everyone. Good afternoon, good morning from wherever everyone is. Today, I will be sharing reflections and insights from my experience with programs over the years as a practitioner, as a reviewer, and from learning studies that I have been a part of. To begin, I want to share from learnings in the early years of my career. I managed an adolescent girls program, which was in different states of India. The program emphasis, it was a very pioneering program. The focus was on adolescent girls, on their empowerment, which was extremely new and unique at that time. The effort was to give them better life options. And as we continued to interact with these girls and young women, their refrain would be that you have changed my life. Now, please change the thinking of my future husband. We were very surprised when we would hear this, but this would come to us again and again. So that was one learning, and I want to move on to another learning from another example, which was from a girls' education intervention in urban slums of Mumbai. The implementing team over there discovered that the brothers were extremely watchful. They were very critical of their sisters who were, going out to access education. They were watching where they were going, who they were speaking to, what they were doing, why, when. So they were monitoring their every move. And surprisingly, the fathers, grandfathers, uncles, etc., they were too busy earning a living, so weren't, involved in this kind of close monitoring. The brothers were the ones who were the obstructing factors. The feeling was that if the brother cannot control his sister, then his masculinity was questioned. And these were boys who were like teenagers. That was approximately the age group. So as you can see, that our realization was from various girls programs that working with girls was not enough. I mean, you could work with the girl, you could empower them, make them start thinking critically, knowledge building, etc. But the girl would then go back into her family. So then there would be dissonance. So to effectively challenge and change these gender inequalities, you needed to get boys and men involved. There was the need to make them allies, and there was the need to change the ecosystem which was around the girl. Just working with the girl was not enough. Just empowering the girl and the young woman was not enough. You needed to work with the brothers, the fathers, families, other men who were there, as well as future partners. So this, as what I've shared so far, is from a girl's perspective. But what about from a male perspective? So men also have their own pressures, face their own pressures and challenges in India. And so as Ravi mentioned right in the beginning in his opening remarks, there are the pressures of being the breadwinner, being a provider, providing for the family. There are pressures of, not showing emotion, that you're not supposed to cry, not supposed to show any weakness or show pain. So there is this kind of dominant perception that a man has to be strong, has to be aggressive. So these are the socialization practices which are perpetuating the same thinking, which is continuing year after year and from generation to generation. Now I want to just talk about this discussion that I had with young men who were college-going young men in Lucknow, Uttar Pradesh. And they shared how they followed So these were young men who were from within Lucknow as well as from nearby areas. This was about 2-3 years ago, and they shared how what they did and they followed was prescribed by society. They did what their fathers, their uncles, elder men in their families and communities did. They had minimal interaction with girls. They shared how they just didn't have that interaction with girls. They didn't have those opportunities. They had no, those spaces were not there. They didn't understand what girls said, what they meant. They didn't know how to talk to them. The strong belief, surprisingly, was that when girls said no, that they actually meant yes. So there were all these, so the whole concept of consent, the whole, was just not them. They just didn't understand girls. There were also unsaid rules on what men can do and cannot do. One young man shared how he really enjoyed cooking. But this is, a kitchen in the household is considered a very feminine space. So the family frowned upon him, learning cooking, and he had to rationalize that he needed to learn to survive, when he lived on his own, to study, to work. So he had to rationalize learning cooking or even enjoying cooking. Otherwise, it was not acceptable behavior. Now, to share about a discussion that I had with young married men. So what I'm sharing here are from learning studies, from evaluations that I've been a part of, from programs. So these are, where I've kind of woven them together. In another interaction in rural Maharashtra, married young men who were a part of an intervention which was focused on engaging men and boys. The age group of these men was between 18 to about 35. So they were involved. There were animators who had been trained, and then animators worked further with unmarried as well as married men. And they shared that how there was opposition from the family, that when they started doing housework and they started helping their wives, there was a lot of opposition from within the family. One man shared that the biggest opposition that he faced was from his parents, especially his mother. And the feeling was, the mother felt that if he did this housework, that he would become his wife's slave, and she was afraid that he would leave his parents and then not listen to her at all. So this was the perception that was there within families if men started to do household work and help their wives. Here I want to share about, I had the opportunity to go to an akhada, which is a traditional wrestling space, a very masculine, space in Varanasi near the Ghats. And this is a space, it's been passed on from generation to generation. The mitti over there, the mud, is considered extremely sacred. It is a space for bodybuilding, for camaraderie. It is, where there is an emphasis on strength and power. And men come from, across age groups here, early morning, predominantly early morning, to engage, or even in other times of the day. And so as you can see, this is a very masculine space, and the kitchen within the household is considered a very feminine space. So there are all these spaces which are quite gendered. So from these examples, we can see that there's this rigid construct of male identity that boys and young men feel this very strong need to conform to. And there is this strong, perception of what is acceptable behavior and what is not acceptable behavior for boys and men. So there is a lot of this pressure on them. Moving on now to what has been done. I want to share that what are some of the interventions and what are the predominant kind of strategies that have been used by organizations to work with boys and young men and older men as well. So there are organizations who have used gender accommodating or gender sensitive kind of strategies, where they've tried to engage with brothers, with husbands or partners, more knowledge building, awareness, etc. And on the other hand, we have gender transformative type of strategies, which Dr. Ravi also mentioned initially. And within the gender transformative kind of programs, these programs actively challenge gender norms. They actively try and address these kind of gender inequalities that are prevalent. Largely, interventions have reached unmarried and married men in college spaces, community spaces. There have been gender sensitization sessions, there have been campaigns or sessions which have addressed gender, patriarchy, sexuality, violence. In different parts of the country, programs have worked differently. There have also been attempts to work with younger men, teenage boys as well. And there have been and tried to equip boys and young men with knowledge, skills, with peer support, a lot of leadership type of capacity building, so that there is this challenging of these, gender norms, trying to change their own attitude, trying to change the practice, behavior of these men, and then, trying to move them into kind of changing attitudes and behavior within families and in communities. So what have been the learnings from all these programs? The learnings have been that it's not enough, as also from the girls, the adolescent girls and young women programs, that it's not enough to work with men and boys through the lens of their impact on girls and women, that you cannot. You do need men involved as allies, as supporters, but that's not enough. You also need programs where you're challenging and this whole traditional idea of masculinity, where there is an initiation of reflection, of questioning, these deep-seated kind of patriarchal mindset that happens. And this is complex, as was mentioned earlier. It needs very long-term engagement. It needs to be very, very consistent because it takes time. And there is also this whole issue about sustainability. Like, if the change happens, does it last for long, or is it only short-lived? And also there is the learning that we need to be careful that including men and boys does not position them as saviors or as protectors of women and girls, because that is, that is something that could happen. So we have to be very careful about that. And to start young, that it's very important to start working with boys from an early age. There are numerous challenges of, as we've seen with various interventions of working with boys and men, that it's not easy. Funding is also is limited. There's not enough funding available. There are also challenges of access, of availability of men, because as they are highly mobile, they're usually engaged in education, skill building, livelihood. So even accessing them, their, continuity in programs, there's usually a very high kind of dropout, which happens. There's some interventions which have then tried to link up with activities like sports or with skill building, where then a component of gender sensitization may be added. I want to end with a quote, as one implementer very said, that we have to be very wise to address the man. We have to be very creative. we cannot impose anything from our perspective. We have to see their availability and meet them in their mindset. It's really about bringing about the change. So as the change is important, change in attitudes and change in behavior. Thank you. Over to you, Ravi.
Thank you, Renuka, for giving such an overview and bringing together a lot of other work and experiences cutting across. And it really comes as kind of a, the other side of the story where caregiving role that Radhika talked about, how men post-pandemic or during pandemic got into a caregiving role, but don't even get recognized as caregiver, and what it means to those men, to the end where they are perpetrators of violence, the controlling and displaying other forms of masculinity at large. So how does one deal with these? And Radhika also said it's a caste-based, in fact. The caregivers of those men are from the lower caste and caste hierarchies. So there is an intersection between caste and the kind of roles they perform. We'll come to that later. But MANAK, you have the final say. Bring this all together in your presentation, I'm sure.
Somebody who's male identifying, that's a very dangerous place to be in. I should not have the final say, perhaps. But thank you so much. It's been absolutely wonderful. And thank you for inviting me to the forum. It's been absolutely wonderful and enriching to hear everybody else who's spoken before me. I will try and be as quick and precise as possible. Just see, yeah. All right, so I'm going to actually use many of the cues given by people before, and particularly starting about the space itself, the fact that it's a space to learn and reflect together. So I'm going to be actually maybe thinking through together and bringing together two different pieces of research we did in different points of time. And wait, I realize that this interferes sometimes. Yeah, so bringing together two different pieces of research that we have done and trying to draw parallels from what we saw in working with men and boys before the pandemic and what we are hearing now from many organizations who continue to do that work. And we're doing that through this pandemic and lockdown period, which is more recent. So, so the first research that I'm presenting from is a research called Where the Boys Are. We did this direct research with young men about the construction and expression of masculinities and what goes into creating this image of masculinities for boys in UP. We looked at 3 different cities. The primary method was focus group discussions and in-depth interviews with about 100 young men in these 3 cities, in Lucknow, in Banaras, and Lucknow, Varanasi, and in Aligarh. So very quickly, I will just move straight to what we learned from talking about men, and because everybody else also laid out the field on what we know about men. And just to note, I mean, just to make the slides more interesting than just text out there, I've used paintings from another Ravi Verma, in fact, who's almost as famous as our esteemed moderator in the field of art, as Ravi Verma, who's with us here, is in the field of gender and development. So what we learned about men in that research and how masculinity is constructed and formed for them in their minds through that research was that all of these intersectionalities are extremely important in very nuanced and specific ways. That caste is a huge influencer of what goes into constructing masculinity and how men think of themselves as they're growing up. Caste takes form particularly in this shift from school to college. And that's when, as they grow older, they start getting more and more aligned or more bombarded with messages around caste and caste-based segregation than groupings. Of course, a lot of things around gender stereotypes that we have heard of earlier got confirmed in the research. Religion and nationalism got confirmed in a very interesting way where we, this whole thing of masculinity in conflict, masculinity under threat, having a very specific kind of religious angle to it, not just in the love jihad and men of that community kind of way, but just the positioning of the country as biased and as consisting of one particular kind of Hindu nationality, nationalism and Hindu masculinity, and everything else as an antipathy to that, as in conjunction with that or opposed to that, was a real threat that was observed by men who were part of this research. Around spaces, of course, we've already heard many interesting things about how spaces are differentiated. We also heard a lot of stereotypes around how home is a space that is considered more feminine as against the outside, but within the home, a lot of men talked about how within the home there are certain spaces which are masculine, certain tasks in the so the kitchen, for example, going into the kitchen to keep heavy things was the masculine thing to do, but doing labor in the kitchen or care work in the kitchen was absolutely not masculine in the home space. So a lot of very nuanced ideas around how to look at spaces and where masculinity sort of gets embedded in the household space itself was an interesting finding for us. And then, of course, sexuality. Particular kinds of narratives of caste and sexuality together, where different stereotypes for men who are, say, gay or more effeminate based on their caste, different stereotypes around the body based on the caste became very, very important for men in shaping their own experiences and also getting tuned into what will be or will not be considered cool. If I have to be gay, then there are certain stereotypes around being gay that I have to continuously watch out for, which are coming from my Rajput caste, for example. So those kinds of nuances became very important. The purpose of doing this research was to be able to work better with those men in our interventions. And therefore also the whole research was geared towards how can we do programming, which is better and more specific and suited to the men that we work with. Relationships, some realizations around how friendships are all important. There is one friend or the other who will go into every space of your life, who you will rely on for money, another friend who you will rely on for borrowing a bike, another friend who you will vent to about your relationship problems. But interestingly, no friend that you could vent to about any sexual issues. Right? No conversation of that nature happened between men. The only conversation that perhaps did happen between men and in groups of friends was around a whole lot of sexual stereotyping that I will also come to later, which became a moment of not just expressing your lack of understanding of women, but also your frustration with or your insecurity around having sexual relationships. Romance, of course, the same trope of wife and girlfriend in the marriage was replicated in our interactions with these men who were part of the research. And in romance, this very, very strong trope of betrayal, where if the girls don't want to be with us, it is betrayal. If the girl leaves me, it is betrayal. If the girl likes somebody else, it is betrayal. If the girl just says that, okay, I don't want to be, it says no to me, it was not a rejection. It was actually a betrayal. So, that sense of entitlement that said, this is actually betraying me by saying no to me was very strong in the minds of men. And that's really jumped out at us when we thought about how to work with men on consent and relationships and violence in relationships. Around sexuality and sexualities, expressions of sexuality were, of course, stereotyped that you have to be dominant, you have to be the person who's in charge. A lot of misconceptions about women's sexuality and no place to actually clear those misconceptions. A lot of it was about all talk, no action, that a lot of men, in fact, the men who were talking the most about what women's sexuality is like, that women start off only, having fun after 1 hour and men are done in 20 minutes. The men who sort of made most conversation around it were the ones who had the least sexual experience, actually, interestingly. And these are all insights that came from, speaking to the researcher, to other people who were in that conversation and huddle, and correlations between interviews and focus group discussion. So that gave us a lot of insight onto how to work with men on issues of SRHR and sexuality in general. A lot of pressure and performance anxiety around sexual stereotypes of men that you have to live up to form the conversations between men in friends groups. In media, interestingly, what jumped out at us was that digital access became the new frontier of masculinity. The person who's regulating and controlling the access is the important one in the family. Having that access, getting information from WhatsApp. So information-based messages coming to you from WhatsApp put you in a position of power because you can then give that information to other people. That became a very important part of how you express your masculinity and are in control, are in the cool guy kind of position in your own group. And that became very important to the men who were in that research. Also on WhatsApp and on social media, on Facebook, gender, caste, and community-based groupings persisted. Men were repeatedly put into community-based or caste-based groups. Even if they left those groups, somebody else would put them back again. And they said, okay, I just gave up and said, okay, let me be in this group. Even if I'm not engaging with it, I will just, not make the effort of leaving again and again. And so bombardment of messages, even the daily good morning, good evening messages, which had a certain tinge of a caste identity in there, right? That became the hallmark of people's social media experience, which was very interesting, and it jumped out at us when we were doing this research. On violence, again, like looking at the nuance of what was going on. So friction between men was the defining experience of, defining experience for men of masculinity, entitlement, and power. A lot of masculinity got constructed, and a lot of violence was experienced in interactions between men, and not really so much in interactions between men and women. Of course, there was a huge trope of gender-based violence, a whole set of ideas around gender-based violence that I will not go into because we know that already. But things like, Hindu men beat their wives. In Muslims, it is haram, were quite interestingly jumping out at us as we did these conversations with these men. So actually, even perceptions around gender-based violence got enmeshed with this idea of community and upholding your certain community value, your own community, and saying the other community is actually much worse. They are the ones who perpetrate this kind of violence. When we spoke to young men and boys around, violence between men and women. So these were very quickly the kinds of recommendations that we assimilated from that experience of talking to men and boys in that research. The need to acknowledge the centrality of caste in the male experience across the kinds of interventions that we do, whether it's livelihood, whether it's gender, whatever it is, acknowledging caste, addressing it directly in that group was a recommendation that we had. Addressing those intersectional experiences of men. So intersectionality for us based on that research was not just around recognizing different identities, but was in being able to hold men accountable as well as acknowledge the kinds of pressures they face that RENUKA spoke about. So doing both together in programs was actually where the intersectionality lay, in being able to acknowledge pressures, acknowledge that on various indexes men did not have power, but also in being able to simultaneously hold them accountable to the privilege they have and the violence that they then are able to perpetrate with impunity. That became the centrality, or that became the meaning of intersectionality for us when we talked about it in those programs. Making conversations about consent and relationships more relatable to men. This no means no approach to consent, and talking about that with men was not working. There was no space to talk about rejection, no space to talk about how you feel when you are rejected by somebody, and to get into really that experience of betrayal. There was no space to do that in programs, and we thought that is a must. We need to open up those spaces to acknowledge experiences, emotions, and address them to be able to then eventually move away from violence in how men behave. Supporting the diverse needs of men around information, livelihood, migration, and power. That became an important thing as well. Sorry, am I out of time already?
I've been warned that it's only 5 minutes left and there are questions waiting for you in the audience.
Right. So I'm going to very quickly go through this more recent research that we have done on programming in the pandemic, and take just 1 minute to go through this very, very quickly. Some of the challenges that we saw, of course, everybody knows it. I will not repeat what's on the slide. All of this came up when programs were interrupted, and all of these issues around uncertainty, trauma, anxiety needed to be addressed. Many organizations said they were not equipped to deal with this. And so what I'll do is I will run through the slides, but I will come to what we realized through all of this. Adaptations that were required, a lot of challenges in ensuring engagement, more in gender programming than in other kinds of programming. So the gender programming is what took a biggest hit, because men could not deal with, did not have time for it in the other concerns, or were not interested. The recommendations is, and the central piece of this research for us became that organizationally, we all had to enhance our capacities to be able to address multiple issues together. Organizations had to collaborate so that livelihood issues could be addressed together in the gender programming, that groups of young men that were working on being community support people needed to be, their relationships with other people in the villages, in the sites of implementation needed to be improved. And the one thing that really jumped out at us over here was, again, the centrality of caste and religion in that experience, where, men going in to even provide relief were not trusted enough to be let into the communities, because there were certain stereotypes around who is bringing in COVID, who is the dirty person who's going to actually lead to bimari for everybody else. And that needed to be addressed much more centrally. And that's the dominant thing that we learned doing this research as well. So yeah, I'll stop with that.
All right. Thank you. Thank you, Manak. I hope I'm not rushing you. But you have questions. There's a very engaging audience here, and so I would really begin from you. There are 3 questions, and I'm taking the liberty to directing them to you, Renuka and Radhika. Let me see. The one question is about reflection. If you can, if we can reflect, and I am taking the liberty to ask you, knowing your work on the embodied masculinities, queer masculinities, female masculinities, trans masculinities. So any reflection from you would be really great, quick, brief. And Renuka, there is a question on akhada masculinity. If do you think from your work, is it gender neutral, and any reflection that you think it breaks the boundaries of masculinity boundaries? And Radhika, there's a question on masculinities in non-patriarchal societies, traditions of gender equity and complementarity, some reflection. And I know I'm again taking the liberty to ask you to please reflect on this, and because of your work on reframing masculinities, and one doesn't have to go to non-patriarchal societies to see this. I'm sure there are a whole lot of non-patriarchal men, and they have their own ways of, and I think you have such in-depth work on that. So these 3 in that sequence. So first, Manak, please.
Sure. So I think
if I may just 1 minute.
Sure, absolutely.
Somebody has said that बीच में थोड़ा हिंदी में बता सकते हैं.
Sorry. I wanted to keep that in mind. So please, अगर आप हिंदी में इसके बारे में थोड़ा सा बताते हैं तो ज्यादा अच्छा रहेगा. I think हमारे रिस्पॉन्स अब अगर हिंदी में करने तो बहुत अच्छा होगा.
बिल्कुल, श्योर. तो मैं हिंदी में ज्यादा बोल सकता हूँ, उसमें कोई दिक्कत नहीं है. तो ट्रांस मैस्कुलिनिटीज और मैस्कुलिनिटी के बहुत सारे अलग जो एक्सप्रेशंस हैं, उनके बारे में एक वेरी क्लियर हायरार्की तो हमको समझ में आई लोगों से बात करते हुए कि क्या ऊपर है क्या नीचे है. लेकिन उसके अंदर भी ये जो न्यूआंस की जो हम बात कर रहे हैं कि क्या नेल पॉलिश लगाने तक ठीक है, लेकिन ज्वेलरी पहनना जो है वो थोड़ा ज्यादा हो जाएगा. इस तरह के ग्रेडेशंस, लोग जो काफी मर्द जो एफेमिनेट भी थे, उन्होंने भी ये बोला कि इतना बिहेवियर, इतना एफेमिनेट ठीक है, लेकिन कपड़े अगर दूसरों के पहनना शुरू कर दूंगा लड़कियों के, तो वो थोड़ा ज्यादा ही हो जाएगा. मेरा जो बिहेवियर है वो मेरे लिए ठीक है. तो उसके अंदर मुझे लगता है कि हमने ये भी नोटिस किया मर्दों से बात करते हुए कि एक इनहेरेंट इवन क्वियर और ट्रांस मैस्कुलिनिटीज तो नहीं, हमने ट्रांस फेमिनिनिटी के एक्सप्रेशंस ज्यादा देखे हमारी रिसर्च के एम्बिट में. एंड आई थिंक ये बहुत जरूरी है कहना कि ट्रांस मैस्कुलिनिटी के अनुभव जो है वो फर्मली विद इन मैस्कुलिनिटी स्टडी हम लोग बहुत कम देख पा रहे हैं. आगे जाते हुए हमारा हमने काम जो लिया है वो ये कि ट्रांस मैस्कुलिन मर्दों के लिए सेक्सुअलिटी के अराउंड रिसोर्सेज बनाने की बहुत जरूरत है, क्योंकि ये बातचीत होती नहीं है मैस्कुलिनिटी के कॉन्टेक्स्ट में. और मुझे लगता है कि ये इस फील्ड को एक्सपैंड करने की इस डायरेक्शन में डेफिनेटली जरूरत है, खास करके लाइवलीहुड और एक्सपीरियंस ऑफ द वर्क प्लेस, जहां बहुत सारे हम लोग डिस्क्रिमिनेशन और वायलेंस के एक्सपीरियंस देख रहे हैं ट्रांस मैस्कुलिन मर्दों की तरफ से. वो आई थिंक एड्रेस इनफ किया नहीं जाता है इस सिचुएशन में. और आई थिंक ये डिस्क्रिमिनेशन ऑफ जिस तरह का केयर वर्क जिसकी राधिका बात कर रही थी, उसमें अपॉर्चुनिटीज भी ज्यादा सिस मेन को होती हैं कि ऑफिस बॉय वगैरह के काम के लिए जो कोई फीमेल असाइंड है उनको हम नहीं ले पाएंगे. तो आई थिंक दैट इज डेफिनेटली एन एरिया जहां हमें और काम करने की जरूरत है.
Thank you, Manak. Renuka, your turn, please.
Yes, हाँ जी. Thank you. So about अखाड़ा के बारे में अगर मैं बात करूं, वाराणसी में तो मैंने विजिट किया था और बात की थी, पर यहाँ पर रिसर्च का मौका नहीं मिला था. So मुझे इतनी डिटेल इंफॉर्मेशन नहीं है. I think research की ज़रूरत है क्योंकि ये वाराणसी में अखाड़ा काफ़ी हैं जो कि exclusively masculine space है. But class or caste is definitely a factor that the men who come there जो हैं वो higher class के और caste के हैं जो कि इन अखाड़ों में आते हैं, especially जो घाट्स पर जो घाट के पास जो है वो अखाड़ा है. तो इसमें और रिसर्च की जरूरत है. Thank you.
Thank you. Thank you. Radhika ji.
Ravi, could you just repeat the question? I didn't quite manage to note it properly.
Yes. I just wanted to give a heads up. That's why I just blurted that out. But the question is that what do we know of masculinities in non-patriarchal societies, traditions of gender equity and complementarity in those societies? Any reflection from your work?
Okay. I think when we say non-patriarchal society, that itself is a slightly complicated category. So let me just say there are specific aspects to different societies where, for example, the role of the father, or who is considered the father and the patriarch in the family, and the kinds of sort of relationships that the patriarch / father has, and what does fathering mean? And I think that what I found really interesting in my own work is the way that fathering is not the sole responsibility of a single person. That in South Asia in particular, fathering is a activity, if you will, or a role and a process that is undertaken by a whole range of different men. And I find quite interesting that when we think about the idea of who is the father in the family, something like the pandemic and the COVID experience in the second wave has shown us that people have actually taken on the role of fathering for a particular family, but have themselves not been necessarily biological fathers. So even when we, but are part of a sort of larger set of people who think of themselves as caregivers who are domestically oriented or oriented towards the domestic. So the range of people who came into play, I think, is quite interesting to track. And therefore, what do they think about the role of the father and their particular roles? Were they just, doing social service, or was this in fact part of how they understood family responsibilities, or what they needed to do for families who were surrounding them as neighbors or others like them? So it seems to me that when we look at particular situations, they reveal certain things to us. And what I find deeply problematic, frankly, in many studies about masculinity is that nobody tracks care. What is being tracked is violence. What is being tracked is the kind of sort of, power relations between men and so on. And I agree, those exist. I do not deny it. Please don't take me wrong. But I think that unless we also track and speak about and make known and make public the whole context of what are supportive practices of men, we are really not going to be able to do very exciting, meaningful intervention kind of work. We need that story. We need that narrative. We need those examples to be out there. So, Ravi, for just a moment, if I were to talk about, what you said about, the bystanders, interviews with bystanders and so on, they may well be, we've never actually asked somebody who did intervene in a situation of trying to stop a harasser. And there are some, we know about them. But we've never stopped and asked that person or made an example or said enough about that life story or that incident. And the moment we keep that in silence, we are as much part of the silence or around masculinities, non-violent practices. And I would really urge that this should be an area that we address.
Thank you for pointing that out. So
ਮੈਨੂੰ ਜ਼ਿਆਦਾ ਹਿੰਦੀ ਨਹੀਂ ਆਉਂਦੀ ਤੇ ਜੇ ਤੁਸੀਂ ਮੈਨੂੰ ਪੰਜਾਬੀ ਚ ਬੋਲਣ ਦਾ ਮੌਕਾ ਦਿਓ ਮੈਂ ਜ਼ਰੂਰ ਕਵਾਂਗੀ।
बोलो जी।
ਨਹੀਂ ਮੈਂ ਇਹੋ ਕਹਿਣਾ ਚਾਹ ਰਹੀ ਸੀ ਕਿ ਜਿਹੜੇ ਸਾਡੇ ਪਿਓ ਹੁੰਦੇ ਨੇ ਇੱਕੋ ਹੀ ਪਿਓ ਨਹੀਂ ਹੁੰਦਾ। ਮੈਂ ਜਦੋਂ ਬੜੀ ਹੋ ਰਹੀ ਸੀ, ਜਦੋਂ ਮੈਂ ਮੇਰੀ ਫੈਮਿਲੀ ਅੰਦਰ ਸਾਡੇ ਮਤਲਬ 4 ਪਿਓ ਸੀਗੇ, ਸਾਡੇ ਕੋਲ 4 ਪਾਪਾ ਸੀਗੇ, ਇੱਕੋ ਹੀ ਨਹੀਂ ਸੀ।
बहुत सही बात आपने कही रात। मैं समय पूरा निकल गया है, ऐसा मन कर रहा है कि और भी डिस्कशन हो सकते हैं इस पर, ऑडियंस भी बहुत सारी एंगेज्ड है। मैं आपको बताऊं, हम लोग का जो रिसर्च है, जो बाय स्टैंडर्ड वाला, मैंने जरूर उसका संदर्भ दिया, लेकिन जो सारी स्टडीज ये शो करती हैं कि जो जेंडर इक्विटेबल मेन हैं वो इन वायलेंट प्रैक्टिसेस को नहीं एंडोर्स करते हैं। सीधे अगर सारे आंकड़े देखें हम, तो अगर 30 to 40% men are highly gender unequal. In fact, the nationwide study that we did, we found about 30% of men, and these are statistical quantitative measurements with all caveats, but still with all rigor of measurement. ये बताते हैं 30% are highly rigid men in terms of their attitudes and norms that they hold. But there are about 70% who are on the other side of the spectrum who believe in equality and do practice equal behaviors. So we within that 70%, there is a chunk of about 30-40 in the middle that is constantly negotiating their spaces. And one finding which is so evident and such glaring, जो बिल्कुल स्पष्ट होकर दिखती है, वो ये है कि lived reality, जिस reality में men और boys रहते हैं, वो इतनी important होती है उनके आइडिया को शेप करने में। बचपन में बढ़ते हुए अगर हमने वायलेंस देखा है, वायलेंस को महसूस किया है, वायलेंस के बीच में रहे हैं, तो हम वायलेंस को नॉर्मलाइज कर लेते हैं उसको, और बहुत हद तक वायलेंस को हम रिकॉग्नाइज भी नहीं करते कि वायलेंस अगर हम कर रहे हैं। कुछ चीजों को हम ये भी मान लेते हैं एज ए मैन कि हमने तो, अगर हमारे ऊपर हुआ है तो सभी उस अग्नि परीक्षा से निकल करके इस समाज में टफ बनेंगे। तो आप एक स्टैंडर्ड एज ए मैन हम लोग सेट करते हैं कि क्या हमें टॉलरेट और क्या जरूरी है सरवाइव करने के लिए, ये। और वो जिनके ज्यादा टफ एक्सपीरियंसेस होते हैं, जिनको कि काफी वायलेंस का सामना करना पड़ता है ग्रो होते हुए, वो वायलेंस को सपोर्ट करते हैं बड़े होकर के। इसीलिए सोशलाइजेशन और ये स्टार्ट बहुत जल्दी जीवन के चक्र में जल्दी शुरू कर देना है, इन चीजों का डिस्कोर्स बहुत इंपॉर्टेंट है। स्कूलों में इसकी बातें करना, और जैसे हम बढ़ते जाते हैं हर उम्र में इन विषयों को लाना बहुत जरूरी है, और लिव्ड रियलिटी चेंज करने की जरूरत है। ये सबसे बड़ी लेसन जो हमें लगती है किसी भी ट्रांसफॉर्मेटिव प्रोग्राम में, क्योंकि अगर और लिव्ड रियलिटी ऐसे चेंज नहीं होती केवल अपने व्यक्तिगत विचारों से, बल्कि चारों तरफ जो हमारी संस्थाएं हैं, फैमिलीज हैं, इंस्टीट्यूशंस हैं, जिनके साथ हम संपर्क में आते हैं, जहाँ पे ये रिजिड मैस्कुलिनिटीज रिप्रोड्यूस होती हैं, कास्ट हायरार्कीज रिप्रोड्यूस होती हैं, उनमें परिवर्तन लाने की जरूरत है। तभी ये सस्टेन किया जा सकता है ये पूरा ट्रांसफॉर्मेशन प्रोसेस। और उसमें आई एम सो कन्विंस्ड कि देयर आर सो मेनी मेन हु सपोर्ट इक्वल एंड इक्वालिटी ways of relating and supportive aspect of the caregiving aspect that gets them non-stigmatized. I don't think the pandemic at time with your care, whatever happened, that was so transformative. One has to do a study, one has to really take a deeper dive to see how this caregiving role of men as someone who in the mobile men, of course they belong to the lower caste, as you said. So there is already hierarchy built in. And was that really in, did this have the potential to challenge the power dynamics? Is something that needs to be studied, that needs to be looked at in the longer run. As the pandemic gets over, we go back into normal, so-called normal situation. We should not be like rubber bands that we go back into our own positions, and transformative potential of this pandemic should be also studied. I'm absolutely with you on that, because some of the fundamental shifts have happened in our gender relations within families and outside in workplaces. So, so I think it was very exciting. There is a question for you, Dr. Radhika. I'm sure that we can take it up later. Someone want to know more about this care work for food delivery services and surveillance of mobile workers' body temperature, especially and all. But I think I would just leave it, because since we have really overshot the time, and we should not be thrown out of this platform by ISST. So I think I'll just stop here. I really thank all three of you. It's been very exciting and a learning experience for me, and I'm sure others have also enjoyed it. Sri Rupa, would you please take the floor back from me and bring it to a conclusion in some ways?
Yeah, thank you so much for this very vibrant presentations and discussions. And we just it's a pity we don't have more time to just go on discussing. It has been really fascinating to listen to all of you. So on behalf of ISST and HBS, I would like to extend a sincere thank you to the speaker and the chair, and many thanks actually for unpacking masculinities in contemporary India for all of us, and those brilliant, diverse examples that you brought in from the field as well. So I would also like to thank HBS for supporting this discussion forum for the 10th year in a row now, and we hope to continue our partnership with you. Most importantly, I'd also like to thank the participants for joining us today and making the dialogue very engaging. Shout out also to the ISST team who made all this happen. And to all the participants, we would be sending out the online feedback form to all of you. Please spare a few minutes to fill those up and send it back to us. And
take your body temperature when you send back the feedback form.
Oh, it transmits. Temperature also transmits, so that.
So thank you once again, everyone, for joining us today, and we look forward to seeing you again for our future events. Good night and see you next time.
Thank you. Thank you, Sri Rupa, and everyone.
Thank you very much.
Thank you so much.